I'm Jacqueline Phillips. I'm an associate clinical faculty member here in the Department of Health Sciences. Our students in health sciences take preparatory science courses like biology and chemistry and anatomy and physiology. They also take courses that help to prepare them within the healthcare system, like ethics of healthcare systems or the economics of healthcare systems. And then we do have our students take classes that give them hands-on skills like health assessment, where they learn to do things like take blood pressure and talk to patients. Our students in health sciences are typically on one of two paths. So one path could be that they're planning on becoming a healthcare professional. The other path could be that they're planning on working straight out of receiving a degree here. So they're looking to take classes that can help them prepare for entering the workforce. Our health sciences program gives students a lot of flexibility, so they can potentially enter graduate school afterwards in physical therapy, physician assistant programs, medical schools, occupational therapy. Our degree helps to prepare students for any healthcare field because we have the flexibility for them to take all their prerequisite courses and get those requirements that they need. For someone in the four-year health sciences program who's not aimed at going to graduate school afterwards, you could end up working in a research facility or part of a research program. We have students that go on to work in public health sectors, so whether it's for the community or for different aspects like that. And there's also the option to take a more advanced research class where they are actually working on their own research project of some sort with faculty members. So we integrate this into our program because we understand how important it is for students to understand how research is done, especially most of our students are becoming healthcare practitioners and all of healthcare is based off of research. So making sure that we're using the evidence and we understand how that evidence was created. Having worked at several universities within the local area, I can say it's a very unique experience for students to get the opportunity to work in a lab with anatomical donors or cadavers. So that experience helps students to really understand not only to have compassion for their patients, but it also helps them to learn anatomy at a deeper level with a deeper understanding of spatial awareness and what these structures actually look like in the body. Our facilities here within the Department of Health Sciences are phenomenal. We have great laboratory spaces. We have our cadaver lab with anatomical donors. We also have a lot of software that we're using that is more advanced. So software that is used in all of our anatomy and physiology courses, which students get free access to download to their own computer or iPad so that they can also use it to study from. But it shows a downloaded individual and you can see different cross sections or different muscles, different landmarks on that person. I think at Drexel, we offer the opportunity to get hands-on experience. So whether that's in our courses, for instance, freshman year, you are introduced to professors in different clinical programs like physician assistant program, physical therapy program. You're taking courses that give you hands-on clinical skills. You're in state-of-the-art labs. You're walking out of here with experience and knowledge that other students in the same seat wouldn't have. Within our department, we have a few things that help students academically and then also socially, personally. We have excellent faculty members that welcome students into their offices. We are present, we welcome students, we want to see them outside of class. Beyond that, we also have peer mentors. So we assign freshman students to an upper level student, and that can be for a lot of different reasons. It might help students academically, which classes should they be choosing, but they can also find out what's the best lunch truck on campus. Everything's always advancing within healthcare, but our faculty do a really great job of making sure that they are up to date and experts in what they are teaching and constantly moving the curriculum, redesigning classes and integrating new information and activities to best reflect what's actually happening in the real world. Our our health science students within their first year, their first quarter, are taking a variety of courses. One of my favorites is Intro to Health Professions. So that's a course where students are introduced to several different healthcare professions. So our physician assistant program comes in, our physical therapy program comes in. We have a lot of guest speakers to make sure students are aware of the different options in front of them. And students are also given the opportunity to sit in on different classes within our graduate programs. There's other activities too, just to help students find their way and to make sure that they're getting comfortable at Drexel.